o'clock, so I think we're going to get started. Welcome. I'm excited to bring you this topic today. I think it's really important, and I think it's something that we really need to talk about. So kudos to you for taking the time to learn something more about self-care for the vaginal area. It takes time and effort to care for ourselves, and I think it's great that you're all here today. So today's agenda, well, let me introduce myself. First of all, I'm Jami. I think there's a lot of new faces here I don't know. And I'm an esthetician here at Aesthetic Surgery Associates. I've been here a long time, almost 20 years, so you may very well know me since I've been around for so long. And even though I'm not a doctor and I'm not a vaginal specialist, I'm a woman like you all in my 50s who was looking for some solutions for different issues that were happening in menopause. And so I thought that I would not only talk about the CO2 Lift V today, which is the treatment we're going to highlight, but I think I'd like to talk about some other things too, because I think that it's important that you all know what your options are, because there's actually a lot of options these days for issues that we may be experiencing from menopause and also just post-pregnancy as well. So it's probably gonna take me about 40 minutes or so today. And we're gonna first talk about what's happening in menopause, what's a healthy vagina and what's happening in menopause. And then I'm gonna go into the CO2 Lift V. Then we're gonna talk about anti-age growth factors, the VFit Plus, and then I'm gonna also go over some in-office treatments that are options as well. We don't offer them here at our office, but I think it's important that you know what's out there so you can research it if it's something that you want to look into. All right, so I want to start out with some statistics first. And I thought it was kind of sad that 65% of women are unable to even say the word vagina. They can't even talk about their own anatomy. And I think that's kind of sad. We should be able to talk about our different body parts, because the vagina is just as important as other areas of our body, and the healthier that is, the happier we're going to be. 63% of women will have sexual dysfunction. So you're not alone if you're having these problems. It's a very common issue. 60% of women will have urinary tract infection issues. 43.4% will have pelvic pain. And 90% of women do not seek help for vaginal atrophy, the issues that they have as they go into menopause. And I'd like to change that so that you know that there's some options. So first I'd like to talk about, what does a healthy premenopausal vagina look like? What's going on? First of all, the vagina has a microbiome. Now, most of us have heard of microbiome these days. We have our gut microbiome, we have a skin microbiome, we have a vaginal microbiome, and it's a colony of microorganisms, bacteria, and some other things, and they're essential. We need that microbiome. As a fun little side note, you actually have 1,000 times more bacterial DNA in your body than you do of your own DNA. So we have so much bacteria in our body, and it's super, super important. And in the vagina, the microbiome works hard to keep the pH at a very acidic number. It would be like between 3.5 and 4.5. And if we don't have an acidic pH, then unfriendly bacteria are going to thrive in our vagina. And 99% of the bacteria in our vagina is lactobacillus. So we have lactobacillus, low pH, and then we have glycogen is the food source for our for the lactobacillus. And the more glycogen you have, the healthier your vagina is going to be. When your gut microbiome is off, it can actually affect your vaginal microbiome. So premenopausal women will have lots of lactobacillus, lots of glycogen or food for their lactobacillus, and a low pH. And then also premenopausal women produce lots of estrogen. We all know that, right? And this results in more glycogen, because the glycogen kind of comes off the lining of the wall, the healthy vaginal wall. So you'll have a nice thick vaginal epithelium or lining of the vagina. It's plump, it's pink, it's healthy. lots of secretion, so things are moist, and you would have a low vaginal pH, lots of lactobacillus. So what's happening as we get into menopause? Well, we all know that our estrogen decreases. That's no surprise. And when our estrogen decreases, the vaginal tissue becomes thinner. And when that happens, we can have micro tears, we can have bleeding during sex, we can have dryness, painful sex. And the vagina also in menopause does not produce glycogen like it used to. When you have this vagina that's getting thinner, it's not as thick, the lining, it's not giving off as much glycogen. So essentially, your lactobacillus or your bacteria are starving to death. So that's going to affect the pH of our vagina. And when the pH changes, vaginitis and bacterial infections can start to happen. And it can also lead to urinary tract infections, which can be a chronic issue in menopause for a lot of women as well. So when your vaginal microbiome is off, it can also affect pain and your sex drive. And then you also start to experience loss of elasticity or atrophy of the vagina. You start to get a decrease in secretions, dryness, and we start to develop, or we start to not have as many blood vessels. And you're not getting enough blood flow to the tissue anymore like we used to. And as we get older, stem cells, collagen, nerves, blood vessels, connective tissue, all these things just decline with age. And then the vaginal muscle itself becomes lax, and that would, make you experience a decreased sexual response. Now, we can also have overall weakening of our pelvic floor. And I think many of us, unless we've had a child and had issues, don't even think about our pelvic floor. But those are the muscles that are like a sling, and they hold everything up. They hold up your bladder, your rectum, your vagina, your uterus. So it's very important that you have that sling there that's holding things up. 1 in 3 women will have pelvic floor dysfunction, and that can equal pain, incontinence, and that means you might not be able to hold your urine, but not only urine, but gas and stool as well. And you can have pelvic floor prolapse, where things start to bulge into each other, and you can literally have things bulging, these organs bulging out of your vagina. And it can be harder to orgasm when your pelvic floor is affected. And again, 1 in 3 women will have pelvic floor dysfunction. So I think it's important to pay attention to our pelvic floor, even if we're not having issues yet. And things like Pilates are good for our pelvic floor. I also recently purchased something called a Cooch ball. It's a fun little name, but you sit on the ball. It's developed by a Pilates teacher. You sit on the ball and it brings more blood flow to the area and helps with a little fascia release. And it can really help strengthen the muscles in the pelvic floor. So that is a fun little way. 3 minutes a day, you just sit on your little ball. And I think that's a great way to address keeping your pelvic floor healthier, or if you've had pelvic floor issues, to help even if you're already in therapy. And if, by the way, you are having problems with pelvic pain and pelvic floor dysfunction, there are physical therapists, pelvic floor physical therapists out there, and I highly recommend that's what you seek out. There are answers to these issues that we have. And then pregnancy also takes a toll on the vagina and the pelvic floor muscles and just overall function. So it's not just menopause that will create these issues, it's also pregnancy too. So what can we do? That's the question, and that's kind of why we're here today, to talk about some treatments that are beneficial. Now, hormones have always been the gold standard, and I think hormones are still great. And not everybody can take hormones. Not everybody wants to take hormones. Not everybody feels comfortable taking hormones, or they've had health issues that keep them from doing that. But it's still an option. There's traditional hormones and there's bioidentical hormones, which bioidentical hormones are a little bit more chemically identical to your own hormones. I personally do bioidentical hormones. I love them. I think they're great. But again, that's not right for everyone, and traditional OBGYNs are not all on board with bioidentical hormones. If that is something you're interested in, Dr. Al Peters is great. He's the Center for Hormone and Anti-Aging Wellness. He is a great person to see if you're interested in doing bioidentical hormones. Even if you're doing hormones, you still may have these issues, vaginal issues that we get in menopause, because it doesn't always rectify the problem. And sometimes they'll give you vaginal estrogen because you have receptors right in your vagina. It will uptake the estrogen, and that can really help with collagen building in the area. So it's great for your bladder. It's good for everything in that area. But not everyone wants to do hormones again, or for whatever reason can't do it, or they're just not comfortable using that product, or they're doing this, but they're still not getting as much result as they would like. All right, so let's talk about CO2 Lift V. This to me is one of my favorite treatments, home treatments that you can do. And what is CO2 Lift? It's carbon dioxide. And carbon dioxide's been used since 1933. They've used it in injectable form. They've used it in Europe. They've injected it. Now, that is very uncomfortable to have it injected. But it's also been used for vaginal rejuvenation for 50 years, so for a long time. But CO2 Lift V is now the first non-injectable, it's a topical gel that gives just as good of result as the injectable. So it's been shown to work just as effectively as the injection. And it's a medical grade home treatment. So don't let it fool you just because it's a home treatment. Does not mean it's not super effective, and it's actually medical grade. How does it work? Well, what's happening when you apply the CO2 Lift V mask to the tissue is you're getting an intense rush of oxygenated blood to the area, to the treatment site. So we also have this for face. You can do face, although the vaginal treatment and the face treatment are two different products. So whatever tissue you're treating, you're getting that oxygenated rush of blood to the area. And this helps to maintain healthy tissue function, induces new blood vessels and new nerves, and increases hydration in the area. It also really increases that blood flow, so that creates an induction of growth factors, which growth factors look for injury, and they start to heal irritated, injured tissue. And the tiny blood vessels of the genitalia will become healthier, and that will increase your blood flow in general, even when you didn't just do a CO2 Lift V, because now your blood vessels are healthier. Because remember, one of the issues of menopause is our blood vessels decrease. We do not get enough blood flow, and flow is everything. We need good flow down there for everything to work properly. And it also helps with the pH of your vagina. So remember, as we get into menopause, we have less glycogen, less lactobacillus, less glycogen, and now our pH starts to get altered. So this helps with the healthy pH of your vagina too. So what are the benefits if you're using the CO2 Lift V? First of all, you're going to produce your own natural lubrication, and you can have less painful sex. So can we give a big thumbs up for that? Because we all know that that alone is wonderful. But it also tightens and lifts the tissue. It makes the tissue more plump, and it can help your vulva or outer genitalia, like your inner labia, outer labia, that whole tissue look smoother, plumper, and brighter. So not only internally, but it really can help externally as well. And I do have pictures of almost like reinflated labias. They're looking kind of like this. The next thing you know, they're like plumped out. So it really does help the appearance as well as the function of the whole vulva and vaginal area. It is hormone free, so it's extremely safe to use. It can increase hydration by up to 117%. You have better sensitivity when you're using CO2 Lift V, and it can help relieve itching and pain. So it kind of helps take you from a raisin to a grape, or kind of from sandpaper to butter. So doesn't that sound awesome, ladies? Well, who is this going to be for? It really is for any woman who just wants to care for herself down there. There's no specific age. There's, most people really can use this product. It's really for anyone experiencing any of the issues we discussed, or they just want to keep their vaginal tissue healthy. But it's also great for women who have had babies. It's great as a post-pregnancy care. And it's really good for lichen sclerosis And if you don't have lichen sclerosis, you probably do not know what it is, but it's an autoimmune disorder that creates scarring, itching, pain in the whole vulva and vaginal area. It is not a pleasant thing to have. And I think the only thing they really do for that is steroids. And so this will not cure lichen sclerosis, but it can calm the tissue and soothe the tissue and do some healing for patients who have this autoimmune disorder. Also, polycystic ovarian syndrome can create some sensitivity as well. And so this would be fabulous for that also. So you can use it along with hormones. So even if you are using vaginal hormones or oral or topical hormones, you can use this right along with it. Or other office treatments. If you're having any kind of laser treatment or anything in office, a labiaplasty, which is like a surgical revision of the vaginal area, this would be wonderful for post-healing. And you can even use it pre-healing as well, before your procedure, I should say, to kind of get your skin in better condition, increase the blood flow, and make it healthier. So how do you use this? I'm going to show you. I have a box of CO2 Lift V here, and this is pretty much what you will get if you get a box of CO2 Lift V. All right, so what it is, I'll show you how we mix this up and use it. You would take a big packet and a small packet, and when you buy the 5-pack, you'll get 5 of each of these. It comes in a 3-pack and a 5-pack. And you would first get a bowl, and you would take the big packet. It has a little thing, you just rip that off, and you squeeze all the contents of the packet into your bowl. You would then take the small packet. I would suggest before squeezing out the small packet, you would take it and soften it up. This packet, the contents will get a little thick, and so you want to kind of soften it if you can. And then you're going to squeeze this out. I want you to make sure you get all the contents out. I will usually fold it in half after I've squeezed it and really squeeze every little last bit out, because it's important that we have all the contents from each packet to equal the CO2. So it makes the CO2, because it's not CO2 until these 2 packets come together, create that carbon dioxide. You're going to take your little mixing stick and you're going to mix it real good. And it's going to be like a jelly-ish consistency. You're then going to take one of your little syringes and you're just going to pull up and pull some of the product into the syringe. You'll insert it about 1/3 into your vagina and you'll let it go in. This really just goes in really easily. It's easy to use. Now you may want to suck up a little bit more and put some more in, but there'll be some left behind and you'll want to take that and apply that externally, because remember, smoother, plumper, more blood flow, healthier tissue. It's going to make everything healthier. Now you need to leave this in for about an hour, at least 45 minutes. I will usually tell patients an hour. Now you can sleep in it overnight for convenience. You're not going to get more result by sleeping in it overnight, but you just might want to do that because it's easier. If you're just going to leave it in for 45 minutes to an hour, just kind of relax somewhere, you probably could kind of do a little something standing up, but I think it's easier if you're just sitting down, making sure it's not flowing out of you. And then once your hour is up or the morning has come, you would go and kind of clean the outside area off. I think getting it out is a little tricky, I will admit. I think it's very easy to use, but I think kind of removing it's a little strange. I think the easiest way might be take your little syringe, so don't throw it away, save it, and get a little bowl of water and literally, I think, squatting over in the tub and just taking that and putting some water and kind of squirting it a little. It's a little bit of maybe a nuisance, but it's worth it for what you're going to get in the end. You don't have to worry if there's some left behind. It's not going to hurt you. If you're running off to work or something, put a little panty liner on or something, and it really should be fine. I didn't find that to be an issue at all. And next question I know is going to be, well, how often do I use this? Well, that's going to be variable. I will tell you, in the studies, they did 10 treatments and then 1 a month for maintenance. And the way they did that was they did 5 treatments. They did it each day for 5 days. They took 2 days off and did 5 more days in a row to really get that rejuvenation going And then maintenance mode was once a month. So I think in most of the clinical studies, that's the way they did it. What do I think patients are going to end up doing? I think, and even for myself, I feel like doing one a day for 5 days is kind of a lot. And I don't find that working in my schedule as easily. Doesn't mean you can't do it. You absolutely can, because I think that'll be like rocket fuel and really get things moving in a great direction. But I think for most people, it's going to be easier maybe to do one a week for 5 to 10 treatments and then go into a maintenance mode. This really depends how far along things are for you and what kind of issues you're having, how many you actually have to do. But I wouldn't just do one and think, oh, well, I don't know if that helped enough. You gotta at least do a few. Most women, by the 3rd treatment, they're noticing something's happening for sure. I think on average, a person's gonna notice something after one. They're just gonna notice things feel better. But I think you gotta give it at least 3 treatments. And that's why we usually only sell it in a 3-pack or a 5-pack. And then the maintenance would be once a month. There's, like I mentioned to you before, there's also a facial CO2 mask that's also beneficial for hydration, plumping, blood flow, making your skin look healthier and better. In fact, I did one last night on myself. So once a month maintenance would look like you can be doing your vaginal CO2 lift V and you can be doing your facial one at the same time. How much is it? That's the magic question, right? So for a 5-pack of CO2 Lift V, it is $600. And for a 3-pack, it's $360. I think the average person, if they can, should invest in the 5-pack if they can. I think you're just going to get a better result with that. Now, I am sensitive to the fact that this won't work with everyone's budget. So I am going to give you another option that is a little bit lower in cost, but this is definitely one of my favorite treatments. So I think I'll stop now and see if anybody has any questions in particular about the CO2 Lift V before I go on. Yeah, if you could put it in the chat, that would be great. That way, if there's any questions you're thinking of right now while we're talking about it, not that you forget until we get to the end. And then you don't even remember what you wanted to ask. Although you can gladly put in the chat later. So far, no questions. I guess I explained it well. I hope you ladies are excited about this treatment. I am, but I'm also excited about the next 2 I'm going to talk to you about too. All right, I don't see any chats coming up, so I'm assuming that we probably don't have any questions right now. So now I'm going to go to the anti-age. Now I'm going to go to the anti-age growth factors. This is another option for
Side effects.
Excuse me?
Someone wrote side effects.
Oh, side effects? I don't really even know of any side effects. I know that Lauren is in here from, I think, CO2 Lift. Lauren, if there's any side effects, can you let me know? Because I really don't know of any. It's actually really very comfortable to use. And it
Can you hear me, Jamie?
Pretty much everyone.
Can you hear me?
Can I pull up this chat and look?
Nope.
It's not coming up. Oh, there it is. Okay. Yes, you can absolutely use with estradiol. Yes. And yes, great question about the, how do I get out of this chat, Allie? Do I just click on the
Just
chat?
click on the actual screen. Or you can select it over.
Okay.
Yeah, you can move it over too.
It's not moving. Sorry.
That's okay.
Sorry, technical difficulties, guys. Okay, that's perfect. Thank you. Yes, you can use it with your hormones. You can use it with anything else you're using. It'll just enhance what you're already doing. And the CO2 face product is a little bit different. The vaginal one has an extra ingredient or two. I know it's going to help with the pH. It has something in extra to help with inflammation as well. Yes, exactly. It's even safe for cancer patients. So if I have patients who will talk to me about they've had radiation therapy and for either anal cancer or anything in the vaginal area, and no one gave them any solutions for the issues they were having after this radiation. This would be such a wonderful treatment to do in combination with that to really help with healing of the tissue. All right, I think that's all the questions that we had right now. Look, now I'm going to go on to the anti-age growth factors. So the anti-age, it's basically an affordable regenerative vaginal moisturizer. And it's non-hormonal, just like CO2 Lift V. It's non-invasive, and it's done at home. Will insurance cover this treatment? Sadly, insurance doesn't cover a lot of wonderful treatments that we get done for wellness. It just doesn't. And so, but the investment out of pocket to me for wellness goes such a long way, because I feel like our insurance and our health system is kind of based a little more around sickness. And I think when you want to do something more in the wellness arena, a lot of times we do have to pay out of pocket. All right, so the anti-age growth factors, they're growth factors, basically, and it's in a hyaluronic acid base. And growth factors will help to contain, or I'm sorry, they'll help to rebuild the vaginal wall and promote healing of vaginal atrophy and eliminate pain and urinary distress. So, and then the hyaluronic acid really helps with moisturization. It's a safe solution to help achieve relief from the symptoms of vaginal atrophy and thinning of the vaginal wall and of menopause and pregnancy. It's safe for oncology patients also. It's safe for breastfeeding mothers. And it can be used with laser procedures to help give an excellent burst of healing growth factors to accelerate healing. So I guess the difference between this and CO2 Lift V would be that this is adding some growth factors into the area to try to regenerate and rebuild, where CO2 Lift V is helping to bring a rush of your own growth factors to the area and get some remodeling and rebuilding of your tissue. So that's one of the things that I say is different. And I know that with the CO2 Lift V, it really does help with the pH of the vaginal area, where I don't know with the growth factors if there's something in there specifically that will do that. When you use the vaginal growth factors, you will apply it before bed, and you'll just allow your body to absorb it while you sleep. So this one I would definitely sleep in. And when you use it, you just, let me show you what it looks like first of all. This comes in a 6-pack. It comes like this. And you would just take one of these. You would pop the top off here, pull it, insert, and just squeeze the whole contents into the vagina. You could also take what's left and put it on the outside, because again, it's still going to help the tissue. It's not just for the internal tissue, it's for external tissue as well. And it's very easy to use. I mean, it's not hard. I feel like just put it in right before bed, and then if you have a garbage by your bed. And the way you would use it is to do it once every 2 to 3 days for the 6. And then if you needed to continue, you could do 1 every 6 days until you've had improvement. Now, what I tell patients, here's what I tell patients. I say, look, I think it's best if you do a treatment every other day for 2 weeks, and then do a treatment once or twice a month for maintenance. I personally think that's the best way to use the vaginal growth factors. So these are 140 for a 6-pack. So you can see how that can be a little more economical version for patients who just can't fit it in their budget to do the CO2 Lift V. I have another question here. Do you repeat CO2 after you go through the initial treatment? You would do your CO2 Lift V. At first, you would do your original, however many you're going to do, 5, 10, and then you could do the monthly treatments. And I would say you don't have to repeat that series again unless maybe you're starting to notice some things changing or happening. Then I might go through a series of maybe 5 again. You could do them every day, or you could separate them weekly and then go back into a maintenance. That's how I would approach it. What's the best treatment for a prolapsed uterus? Well, I would say pelvic floor therapy seems to me that it would be a great option if you haven't already looked into that. And I would think that the CO2 Lift V, I think any of these treatments would be beneficial. for that area. Even the device I'm going to talk about in a moment, I would think would be beneficial for a prolapsed uterus. And how do you determine which treatment is best for you? I think that if I were going to say I'll tell you what my favorites are once I'm done with talking of all three of these. But I think I would choose the CO2 Lift V and or the device I'm going to show you if you can. If that does not work in your budget, then I would go with the anti-Age growth factors. Because anti-Age growth factors are very good, don't get me wrong. There's a lot of options. Guys, there's a lot of new options coming out for vaginal wellness. It's pretty exciting. I mean, really, new stuff's coming out all the time. So some of it is what you feel drawn to, and some of it's going to be what your pocketbook will allow, really. So I'll go over one more treatment, and then I'll talk about, what my favorite is and what I would do. So this treatment I discovered over COVID, and this is great. I can attest to you, this works fabulously. It's called the VFit Plus. This is actually a device that you use at home, privacy of your own home, again, which is wonderful. And it's an FDA approved device, and it helps with the issues of vaginal atrophy. It helps with thinning or the atrophy of the vagina. It helps with incontinence, helps with loss of pelvic tone. So that's what we were just talking about. Prolapsed uterus, pelvic tone would be helpful. Decreased sensation it can help with, and it helps with the lack of blood flow to the vaginal area. It's not a vibrator, although it does vibrate. It utilizes red light, warmth, and vibration. And the red light and warmth help to stimulate your ATP. ATP is the energy source in your cell and the mitochondria of your cell. And the ATP will help the tissue, give the tissue the energy it needs to replicate and repair, basically. And the heat and the light increase collagen, which helps plump the tissue in the area. And the vibration is gently stimulating, so that helps to increase pelvic tone. All three, the warmth, the vibration, and the heat, or the warmth, vibration, and the LED light, the red LED light, will help with blood flow. And blood flow is critical for vaginal lubrication and pleasure. Again, privacy of your own home. That's what's beautiful about all these treatments, so we can do them at home. You can use this if you're using hormone replacement therapy. You can use this if you're using CO2 Lift V. You can use this if you're using anti-Age growth factors. You can use it as a treatment all by itself. Let's see if it's charged. I'm not sure, and I'll show you if it is. Okay, it is, good. So you just turn on the device here, and then you can choose up at the top, you choose how long you want this to go. Now this is the professional model, so it goes for 12 minutes. If you want 4 minutes, 6 minutes, 8, 10, or 12. I would highly suggest you start at the 8, 12 minutes. That warmth is a lot at first. It feels hot. You get used to it. I don't even notice it now. You choose by pressing this how many minutes you want your device to run. And there's also that's the on-off button, and this is the button to choose your vibration mode. You can choose like which vibration you prefer. I think there's a lot of modes, maybe even 12. Then you turn it on, and you can see how bright it is. You have to insert it so that it is inside your vagina, so you're getting the treatment internally. You leave it on for the amount of time, it'll turn off, and it'll automatically turn off for you. Now, it's been a while since I started on this, but my recollection is that maybe you would use it every other day to start for maybe like 2 months. And then you can go into a maintenance mode of maybe 3 times a week. I personally like to use it every other day because I just feel like it helps keep the tissue healthier. And I love LED light. I mean, I use it for hair loss. I use it for skin rejuvenation. So to me, this is just all part of a good self-care program. This is not sold by us. This is sold by Dr. Al Peters. Now, Dr. Peters is, he rents space in our dermatology department over in Suite 302, and he has these devices for sale. And the really good news is they have actually gone down in price, and now they've run, I think it's about $400. So I think that's a really great price for a home device that works as well as it does. So you asked me what I think, how do you choose? For me, personally, I would choose if I could, let's say money's no object, I'd probably do CO2 Lift V and a VFit because the combination to me is just fabulous. If I had to choose one, again, I would either choose the CO2 Lift V or I would choose the device because I think those are the best options. But again, anti-age growth factors are still very good and they're still going to get you somewhere, ladies, really. If you're just a little dry and that's it, maybe the anti-age growth factors will be enough for you. But if you need a little bit more than that, I think the CO2 Lift V is fabulous, and I think the VFit's fabulous. This product is called the VFit Plus. Okay, it's the medical version of this. There's also a regular device. I don't know if they just call that the VFit, and that one you can get, like, I guess online, but this you have to get from a medical office. And again, Dr. Peters does sell that, and I would highly recommend that's where you get it. You can look at it and see how it works, and you know, they can take good care of you. And they're right next door in our dermatology suite. All right, any other questions? I think you guys have been pretty much typing your questions as we go. Just feel free to pop up any questions that you have.
Earlier, what is exactly in the CO2? Is it just CO2?
I would assume it's proprietary. The ingredients, I forget, it's something gluconate. I forget what the ingredient, I have to be honest. I can't remember. Lauren might want to answer that for us. What are the ingredients in CO2 Lift V? Basically, though, these two ingredients come together and they create the CO2. It's not CO2 until those ingredients, and that's the magic of this, because if you put the CO2 into the pack, I think it wouldn't be as effective when you went to use it, most likely. Yes, we are taping this, and I think we could send a link out. Yes, if someone wants a link.
Someone asked you, is the facial CO2 a different product?
Yeah, I think I said that, but in case I didn't, the facial CO2 is a different product than the vaginal one. Yes, can I spell the growth factor? It's anti-age, A-N-T-E, capital A-G-E. Okay, and we sell those, and we can even drop ship those to your home. You don't even have to come in. We can just drop ship those to you. Now, I really want to go on and also talk a little bit about in-office treatments. We do not do any of these in-office treatments in our office, but I think it's important to know what's out there and what you might want to take a look at. All right, so first, there's laser treatments. And just like we do laser treatments for the facial rejuvenation, in fact, a lot of these things that have been discovered for vaginal use were started as aesthetics, facial rejuvenation, and they realized that we can use it in the vaginal tissue as well. So with lasers, they help regenerate tissue. The light energy from the laser will penetrate the tissue, triggering the body to want to heal itself. And then the area is flooded with growth factors and stimulates the body and tissue to regrow. And it also increases collagen and hyaluronic acid, and the tissue becomes thicker and more moist. This procedure, I'm not sure how much discomfort is involved with the internal portion of it, but if you're doing vaginal rejuvenation for the external, numbing cream is a definite need there, because I'm sure that one is uncomfortable. This one can also be a little pricier. I'm going to say you're probably looking at about $1,000 for a treatment, and you're looking at probably at least 3 treatments, and then a maintenance treatment, probably once a year. Anything that we do for rejuvenation is going to take maintenance, because our body continues to age. So everything does take maintenance, guys, I'm sorry to say. The next in-office treatment that you could look at is radiofrequency. Now, we do the Morpheus here for skin tightening. We do not have a vaginal device, but there's also one for vaginal tightening. And that is radiofrequency. And it'll penetrate the tissue and create deep dermal heating to help rejuvenate and cause new growth of tissue and tightening. Again, I think you're probably going to need like 3 treatments, probably looking at a similar price point to the laser. And you're going to need maintenance, probably 1 to 2 treatments a year. Now, the next one is PRP. Many people have heard of PRP. They use it for vaginal rejuvenation, many times called the O shot, although you have to have specific training to say you do the O shot. It's like a proprietary name. So what's happening is they'll draw your blood, they'll spin it in centrifuge, and your platelets come to the top. and your platelets are where the growth factors and the anti-inflammatory components are. They'll inject that into the vaginal clitoral vulva area for rejuvenation and rebuilding of the tissue and to increase blood flow and to help improve sexual function overall. It can also address scar tissue, which is really great, and it helps bring back the healthy genitourinary tract system. I think there could be some temporary discomfort with this. I think it just depends where they're injecting it. So I think that's an awesome in-office option. And I know there's people around who do that. This is one I'm really interested in. This is newer. I just discovered this treatment. It's called the Cleovana. And the Cleovana is sound wave therapy. It sends acoustic waves into the tissue and causes micro tears, which stimulate nitric oxide, stem cells, collagen, nerves, blood vessels into the area. So it helps increase sensitivity and sexual function. 90% of women will have, this is what they say, 90% of women will have improvement in orgasm. 90% will have an overall improvement, and 80% will have an improvement in arousal. It's non-invasive. It only takes 10 minutes to do, and it's 4 treatments done once every 2 weeks. And then maintenance is on average 1 to 2 treatments per year. So that one sounds really interesting, especially since there's no pain. It's easy to do. I know there's a doctor who does that towards Philly, Dr. Stephanie Holden, because I Googled it and saw her. So I know she offers it. So she may offer some of these other therapies as well. So one last thing I want to share with you that I think is interesting. While I was researching, I came across Dr. Teresa Irwin, and it's TERESAIRWIN. And she calls herself the vaginecologist. And she is a urogynecologist. And she really educates on the issues of menopause and pelvic floor dysfunction. And I think she's a great resource. If you find her on YouTube, you'll find some videos. She'll teach you how to do proper Kegels. There's different ways to do Kegels. And she'll also teach you how to pee correctly, because believe it or not, that matters, especially when you're having incontinence. So she teaches these kind of things. And then I saw on her website that she has a menopause masterclass. So I thought that sounded great. And I think if you're experiencing different issues in menopause, that you should definitely check her out, okay? The vaginecologist. Very easy to find her if you Google her. I think her website's thevaginecologist.com, something like that. If you have any other questions, please type them in the chat now. If you are interested in CO2 Lift V, you give the office a call. If you have further questions, you want to talk to me, I'm happy to talk to you, because I like talking about anything that will help you ladies have a better quality of life, feel better, look better, because that's what it's all about. You can email me. It's jderr, JDERR, at asasurgery.com, jderr at asasurgery.com. So we should contact Dr. Peters for a demo. And what exactly is your expertise? Do you do facials to help with skincare? I am an esthetician, and I do skincare, and I do laser procedures. So if you'd like to come in for a consultation for skincare, I'd be happy to see you. I can talk to you about all this stuff. I sometimes run over across the hall and grab the VFit to show patients. I send patients over to Dr. Peters all the time for evaluations or the VFit. What about, I do not know what Uvifem is. Is that like a lubricant? Maybe? There's a lot of lubricants out there now, and they're using CBD in a lot of them. One of them is called Glissant, GLISSANT. Oh, estrogen therapy. I don't really know about Uvifem. That would be something, because I am not an OBGYN. I only know what I know from taking hormones and from researching things. So I'm sorry, I can't answer you about Uvifem. But the glissant is Glissant, and that is a CBD lubricant. CBD helps with arousal, is what they're finding. So there's a whole bunch of them out there now, these products with CBD. But I know that Dr. Teresa Irwin, the gynecologist, I think she recommends that glissant. So if you're looking for a good lubricant that might be beneficial in other ways, you might want to check that out. Yes, Jay Derr at ASA Surgery. Ali put it in the chat. Hopefully I got all your questions answered. Again, email me or call me if you'd like to talk further or you'd like to purchase the CO2 Lift V or the anti-age growth factors. You can easily find, I'm sorry I don't have Dr. Peters. Oh, there we go. There's Dr. Peters' website, hormonewellness.net. Okay, he's easy to find. You can Google him and you'll love Dr. Peters. He's fabulous. All right, ladies, I really hope you found this beneficial. Hey, if you want to send me an email and just say, hey, Jami, I enjoyed that. I'd love to hear from you, because if you let me know you're enjoying these kind of things, then I'm always encouraged to do more, because I feel like there's a need for this, especially. That's why I thought I needed to open the conversation. And I'll be happy to talk to you if you want to talk further. Thank you so much for spending your time with me at lunch today. And I'm sure I'll see you again, another webinar in the near future.